Welcome. This is Dr. Gloria Gilbere, and today we're going to be discussing inflammatory disorders and specifically how that relates to fibromyalgia. If you're a victim of an inflammatory disorder like fibromyalgia, arthritis, scleroderma, bursitis, or even gum disease, which many times we don't think about that being an inflammatory condition, the coaching and the information that I use in my everyday practice identifies tried and true methods of preventing and reversing inflammation by what we call nutrition-based medicine. What does that mean? Well, it means that your symptoms are more likely attributed to what you're eating. I know. I'm a doctor and also a recovered victim. Allow me to expand on that thought for a moment. According to the Centers for Disease Control and for Prevention, the estimated cases of arthritis and arthritis type, listen to that term very closely, arthritis type disorders in 2005 alone was 21.4 million. However, because of the influx of aging baby boomers like myself, those figures are expected to rise to 41.1 million by 2030. And that doesn't even take into account all the forms of inflammatory disorders, such as those that I discussed earlier, like periodontal disease and tooth infections and gingivitis. So for the millions of you experiencing some form of tendon, joint, ligament, bone, or soft tissue discomfort, the goal is not only to find a natural non-drug solution for short-term relief, but to also educate you on lifestyle changes that help build bone density and repair damage from so many disorders. For instance, tendonitis, fibromyalgia, rheumatoid arthritis, oral inflammation, and any kind of condition that has an inflammatory component. Inflammation is a symptom. The uncommon commonality in all of these disorders with inflammation is not definitely this list only, but it does include generalized joint pain, stiffness made worse by inability to move. In other words, you're sitting for long periods of time, creaking joints, and your joints swelling. Inflammation of the soft and connective tissue, like that of fibromyalgia, and multiple tender spots, the everything hurts syndrome of fibromyalgia. Most individuals have never heard of a group of foods that induce inflammation and cripple, known as the nightshades. This botanical group, known as Solanaceae, is made up of 92 varieties and over 2,000 species. These foods were found to exaggerate an already existing inflammatory condition by a substance contained within its group called solanine, which is a chemical known as an alkaloid and can be very highly toxic. The chemicals have been linked to symptoms ranging from gastrointestinal distress and disorders and general inflammation to nausea, diarrhea, dizziness, gum disorders, and migraines. I've coached thousands of clients around the globe, both via telephone and at my institute in Sandpoint, Idaho. And as long as they follow the protocols outlined specifically for their condition for a minimum of 90 days, they can prevent or reverse life-altering inflammation. However, just as important are the protocols for reducing the overall toxic load of the body, and that has to begin with the intestinal tract, where most of our immune system is based, and we have scientific evidence of that now. So during our 1.5-hour initial consultation, I not only provide handouts and laminated cards that summarizes all the foods that must be avoided, I also provide recipes for alternative tasty dishes that do not induce inflammation. Keep in mind that the nightshade group of foods is not known to cause inflammation, but rather it accelerates an already existing inflammatory condition. It's like adding fuel to an already raging fire and expecting to put it out with a little watering can. In most cases, patients are taking either prescription medications or over-the-counter for symptom care without ever dealing with the raging fire that continues to feed its flames from their diet. It's easy to consult with me from any location in the world. You simply go to my homepage at gloriagilbere.com, click on the To Consult with Dr. G button in the right column, and you'll find a graphic with a telephone there with a world globe. Complete all the new client forms and submit online. As soon as our institute receives the completed forms and either a paper copy of your photo or an email photo, we will contact you either by phone or email to arrange your telephone consultation. We even pay for the call in 13 countries. Yes, I have an expansive practice, and it's all over the world. Your follow-up visits are just as easy because they're built in 15-minute increments. So usually the 15 minutes is all that's required for a follow-up and progress reports. Email support is also available after the initial consultation at the cost of $15 per email page. It's cost-effective, and it's coming from research and information from a doctor like myself who's been there, done that, and knows what works and what doesn't. Thank you for listening.